Hello everyone, my name is Elliot Paz. I am a teaching assistant at Montana State University Northern. For today's lecture, we'll be going over Chapter 10, Healthcare Institutions, out of the book Public Health 101, Improving Community Health by Richard Riegelman and Brenda Kirkwood. And for our learning objectives, we're going to be identifying a range of inpatient healthcare facilities that exist in the United States, identifying a range of outpatient healthcare facilities that exist in the United States, describing approaches being used to define and measure the quality of healthcare, describing types of coordination of care and methods available to facilitate coordination of care, identify ways that healthcare systems are attempting to improve the coordination of care. We're also identifying roles that may be played by electronic health records in improving the delivery of healthcare. We're also describing the cures role and how it may influence healthcare delivery, describing how technology is changing the delivery of healthcare and long-term care, and identifying components of medical malpractice and disclosure of medical errors. So now to start off our lecture, what institutions make up the healthcare system? So in the US, healthcare institutions are diverse and vary widely in terms of services, size, and focus. The range is almost as complicated as on all the different specialties. And this is so the facilities are able to serve new needs and new financial reimbursement approaches. Now, when we talk about all these healthcare institutions, it is easiest to first categorize them into the two main types, which are inpatient and outpatient facilities. For inpatient facilities, these are institutions where patients stay for at least 24 hours. Examples can include hospitals, skilled nursing and rehabilitation facilities, custodial nursing homes, and institutional hospices. The key feature here is the overnight stay, which allows for continuous care and monitoring of patients who require more intensive treatment or recovery time. Now, on the other hand, outpatient facilities provide care where patients do not need to stay overnight. These institutions offer diagnostic testing, treatment, or clinical services by one or more clinicians. Think of your regular doctor's office, urgent care clinics, or even outpatient surgery centers. Patients receive care, and once it's completed, they can go home the same day. Now we can also break down our types of inpatient facilities further. With starting off, they can be classified as a hospital, which are generally designed for short-term stays. Hospitals in the US are typically high-tech, large buildings that play a central role in the healthcare system, both educationally, structurally, as well as psychologically. They are often among the most visible and modern structures in a town. They may be a general hospital, which aims to serve a broad range of patients and conditions, or specialty hospitals, which focus on specific medical fields like cancer, ophthalmology, or orthopedics. Now, there are some key characteristics of a hospital. First off, they must be licensed by the state and are usually accredited by national organizations such as the Joint Commission. And the Joint Commission ensures hospitals meet essential standards for patient safety and quality of care. And also, hospitals often provide 24-hour nursing services and have an organized physician staff to ensure care continuity. Hospitals are also governed by a board separate from the medical staff, which is responsible for overall operations and compliance with state and federal regulations. Now, there can also be different categories of hospitals based on their ownership and funding sources. So first off, we can have a nonprofit hospital, which is about 80% of the hospitals in the US. They are privately owned, run by states, or by the federal government, like the Veterans Affairs hospitals. They can also be run by institutions like universities. Now, about half of this 80%, so focus on the nonprofits, are private and 20% are government run. Then next up we have our for-profit hospital, which is owned by investors and make up roughly 20% of the hospital system. And hospitals also provide many outpatient services, such as diagnostic imaging, laboratory testing, and specialized treatment. Now for our next type of inpatient facility, we have a long-term care facility. And these are institutions that provide custodial care, which involves helping individuals with basic daily activities like eating, bathing, and dressing. They offer limited healthcare services and are primarily designed to provide assistance to those who are unable to perform activities of daily living. Assisted living facilities provide long-term care for those with less severe impairments, though they are not technically healthcare facilities. Now, unlike hospitals, which focus on rehabilitation and recovery, long-term care facilities focus on maintaining quality of life for residents who have chronic conditions or disabilities. Long-term care facilities are usually regulated by the state with federal standards to ensure they meet minimal criteria for reimbursement under Medicare and Medicaid. And the US has over 15,000 nursing homes with over 1.5 million residents, where over 80% need help with mobility, nearly 66% are considered incontinent, and nearly 50% require assistance with eating. Additionally, Alzheimer's patients are the most rapidly growing population right now. All right, now transferring over to the outpatient facilities. While they are varied and complex, and in fact they're probably more diverse and complicated, we can still break them down into two basic types. So to start off, we have our clinician facilities. Traditionally, outpatient care was seen as services provided at a doctor's office, but today this model has expanded significantly. Clinician services are rarely organized around just one clinician. Nowadays, group practices and multi-specialty practices are the norm. These practices often include a combination of doctors, nurse practitioners, physician assistants, and other health professionals who work together to treat patients. And it's not just physicians who provide these clinical services. Other healthcare providers like physical therapists, clinical psychologists, and optometrists may also offer outpatient care in these settings. And essentially, clinical outpatient care has become more collaborative, with multiple specialties working together to address various aspects of patient care. Then for our next type of outpatient facility, we have a diagnostic testing or therapeutic facilities. And these facilities focus on specific diagnostic or treatment services, such as imaging centers, laboratories, or physical therapy clinics. Diagnostic testing may include services like X-rays, CT scans, MRIs, or laboratory tests to help diagnose medical conditions. These facilities typically don't involve long-term care, but instead focus on identifying or monitoring a patient's condition. Now, for therapeutic facilities, they provide treatments such as physical therapy, occupational therapy, or speech therapy, which are designed to help patients recover from injuries or manage chronic conditions. And these outpatient facilities serve a critical role in the healthcare system by providing non-hospital-based care for a wide range of services, allowing patients to receive treatment without needing to be admitted to an inpatient facility. All right, so now what do we mean by the quality of healthcare services? Now, one thing to note is that quality of healthcare can be perceived in different ways. So first off, administrators. They focus on structure measures, so which this involves the physical and organizational infrastructure. So things like availability of operating rooms, lab services, and the overall healthcare facility resources. Clinicians emphasize process measures, which are about the procedures and technical competence during patient care. Then also there's patients, which often evaluate different process measures based on personal interactions with providers, including communication and overall satisfaction. Then we have external reviewers. So for instance, this could be an insurance company, focusing on outcome measures, which evaluate the results of care, such as lives saved, disabilities prevented, or complications avoided. Now, also defining and measuring healthcare quality is complex. Because as we can see, quality varies depending on the perspective. Administrators look at efficiency and resources, clinicians care about technical competence, patients focus on personal experience, and external reviewers examine outcomes. And all three measures need to be taken into account and weighed appropriately, and so the process is very complex and controversial. Now, the National Committee for Quality Assurance, or NCQA, provides a framework to assess healthcare quality using structure, process, and outcome measures. And this helps healthcare systems improve and evaluate care comprehensively. All right, so now what we have here is Table 10.1 from the National Committee for Quality Assurance. And as this outlines key characteristics of healthcare quality to guide assessments and improvements. So the first part of this is the access to care, which refers to the timely availability of healthcare services. This includes ease of scheduling, location, and minimal barriers to receiving care. Access is vital to ensuring patients can get the care they need promptly. There's also service delivery, where effective service delivery involves providing care that is safe, effective, and tailored to patient needs. This includes using evidence-based practices, ensuring proper treatment, and maintaining patient-centered care to meet individual preferences. Now for our second part, we have qualified providers, where high-quality care relies on the competence of healthcare providers. This includes ensuring that professionals have the necessary training, certifications, and ongoing education to stay current with medical advancements, ensuring they can provide the best care possible. And now together, these characteristics form a comprehensive framework for assessing healthcare quality, balancing structural, process, and outcome measures to improve the overall effectiveness and patient experience of care. And the complexity of inpatient and outpatient services in the US has made the quality of healthcare services very challenging. And this complexity of the system raises two closely connected questions. One, how can the pieces of the system be coordinated to provide integrated care? And two, how can we improve and ensure the quality of healthcare? So the coordination and the quality of healthcare delivery is often considered key to both the efficiency and the quality of the healthcare. And this will be the end of part one. See y'all later for part two.